I became a patron of Hepatitis C, kind of because I was kind of close to it, but watching people kind of trying to get through it.
I've got a close friend whose mother and son that have Hep C, and so I get to see firsthand really, you know, how devastating this disease can be on their day-to-day life, and also with regards to their futures as well.
One of the biggest challenges with Hepatitis C is the stigma coming forward, because people don't understand. A lot of people just don't understand that it, you know, it's by default. A lot of people, you know, get it, but it's like any illness. It's like there is treatment out there to be had, and people do get better if they get the treatment.
I think there's a sort of the stigma to it, because people don't really know much about it. So it's sort of getting over that kind of social barrier, and it's, I guess, you know, just down to ignorance.
What's stopping people coming forward about Hepatitis C is that they don't think it's going to happen to them, that there's a stigma about it, and, you know, it's always going to happen to somebody else.
There are more people affected with Hep C than there are cancer sufferers or people that are suffering with HIV or AIDS, and so they don't have the stigmas, that they don't have the support then that cancer sufferers get, and I think that's the most frustrating part, and being able to talk about it as well. Cancer sufferers can talk about it and process. That's part of the healing process, whereas with Hep C, because of the ignorance around it, a lot of people just assume it's just people that are drug addicts that get it, and that's wrong. People need to know that they can talk about Hep C, and that's exactly what the Scottish Hep C Action Plan aims to do. Absolutely at the top of their list would be to normalise this disease, normalise it, and give people the chance to talk about it.
Well, Scotland seems to be leading the way on the Hepatitis C action plan. The Scottish Government seems to have raised awareness, and Scotland seems to be far ahead of lots of other countries.
I would like anybody that feels ill, unwell, you want to go home, and I would want to go home. I'd want to go home to Scotland, because I'm Scottish and I'm proud of it.
In Scotland, patients can access treatment easily. It's about coming forward and getting treatment, basically. Combining
awareness raising with the International Music Summit in Ibiza is perfect, because it's shown, research shows that the most urgent cases are with the ages between 20 years old and 50 years old, and a lot of people, a lot of this demographic like to go and listen to music, and so to have that awareness, to have that summit in Ibiza is a perfect demographic to reach out to this group of people.
If you're 20 years old, or sadly if you're like 50 years old, there's a lot of people that are still caning it. You know, you can do the wrong thing at any certain point, and, you know, yeah, I would say get tested, you know.
If we can reach all these people in one big group and get the message across, the most important thing is to get tested, because if you know you've got it, then you can start to deal with it. You can face the disease head on and live your life rather than fear it. Just the best thing to do is to get tested, because if you know that you've got it, then you're less likely to infect somebody that you most care about. So get tested.